The thing about working for the National Center for Emerging Diseases is that your family never really understands what sensitive means. Not really. To them, it's just a word you use to avoid explaining your boring health department job or to make yourself sound more mysterious than you actually are. I'm Esther Nolan, 38 years old, and I've worked as a senior epidemiologist for NCED for 8 years. My security clearance level is TS/PHBIO with special access to outbreak vulnerability assessments. I study pathogens, analyze transmission patterns, and help prevent disease outbreaks from becoming catastrophic. But to my family, I'm just Esther, who works with vaccines and does paperwork. My older sister Ruth is a civil engineer. My younger brother Moses runs a successful crisis management agency. They have careers people understand, careers they can explain at dinner parties. I've spent 8 years saying I can't discuss my work so many times that my family genuinely believes I have nothing interesting to discuss. The problem started 4 months ago when I made the mistake of working from home during a family visit. I was at my parents' house in Sandy Springs, Atlanta for Dad's retirement weekend. It was supposed to be celebratory, a break from the constant pressure of tracking emerging threats. But Saturday morning, my supervisor called with an urgent situation. An unusual cluster of severe respiratory illnesses had emerged across 3 states, requiring immediate epidemiological analysis. Esther, I need you to review the field packet and provide threat assessment within 6 hours, Director Matthew had said. I'm sending it to your secure system now, but I'm also couriering printed materials. This one's moving fast. Understood, I'd replied, already heading to my childhood bedroom where I'd set up my encrypted workspace. I have protocols for working remotely. Secure laptop, biometric authentication, isolated network connection, reinforced locks. The courier had arrived within an hour. The field packet was 52 pages of sensitive public health intelligence, unredacted case identifications, precise coordinates for contaminated environmental facilities, raw data tied to vulnerable nursing homes, contacts for covert sample transfers, facility security protocols. It detailed a suspected pathogen cluster with potential for rapid amplification. Lives depended on my assessment being accurate and immediate. I'd worked for 4 hours straight, cross-referencing epidemiological curves, mapping transmission vectors, identifying vulnerable population centers. I was deep into pattern analysis when Mom knocked on my door. Esther, honey, lunch is ready. I'll be down in an hour, Mom. I'm working. Working on a Saturday afternoon? Sweetheart, you need to take breaks. It's just health reports. They can wait. I'd wanted to explain that just health reports meant preventing hundreds of people from dying, but I couldn't say that. So I just repeated, I'll be down when I'm finished. Please don't disturb me, and please don't touch anything in my room. She'd gone away, but I'd heard her talking to Dad downstairs. She's locked herself in there with her computer again. I don't understand why she can't just enjoy family time. How urgent can vaccine paperwork possibly be? I'd finished the preliminary assessment at 2 p.m., transmitted it through encrypted channels, and secured the printed field packet in my locked briefcase. Standard protocol. I joined the family for late lunch. Ruth had already left to handle a project deadline. Moses was discussing his latest client project with Mom and Dad. Esther finally emerges from her cave, Dad had said with gentle teasing. Your brother's been here all weekend without working once. That's the benefit of being your own boss, I suppose. My work has different requirements, I'd said carefully. Government bureaucracy waits for no one, huh? Moses had laughed. I'm so glad I left the corporate world. Freedom to disconnect is everything. I'd let it go like I always did. They didn't understand that I wasn't checking spreadsheets or filing reports. I was literally analyzing outbreak patterns that could kill hundreds of people if mishandled, but I couldn't tell them that, so I just seemed like a workaholic with poor boundaries. That afternoon, I needed to run errands for Dad's retirement party. Grocery run, picking up the cake, grabbing decorations. I'd left my secure laptop powered down and locked. The printed field packet was secured in my briefcase, which was locked inside my suitcase, which was in my locked bedroom. Triple security. Standard protocol for sensitive biological intelligence. Family members who'd been briefed repeatedly about not touching my work materials. I'd been gone 90 minutes. When I'd returned, arms full of shopping bags, I'd found my bedroom door standing open. My heart had stopped. I dropped the bags and rushed inside to find my secure laptop still locked on the desk, but my suitcase was open. My briefcase was open. The printed field packet I'd secured, which should have remained locked away, was gone. "Mom," I'd called out, trying to keep the panic from my voice. "Did someone come in my room?" "Oh, honey, yes." Mom had called back from the living room. "I needed to grab your laundry." The door was locked, but I used the spare key from the junk drawer. "I didn't touch your computer, don't worry." The spare key? I'd gone downstairs on shaking legs. Mom, Dad, and Moses were in the living room, and spread across the coffee table were 52 pages of sensitive public health intelligence documents. "Mom," I'd said, voice carefully controlled, "where did you get those papers?" "From your briefcase, sweetheart." "Moses was asking about your work again, and I thought it would be nice for you to finally share for once. You're always so secretive." She'd smiled, completely oblivious. "We've been reading through them. It's actually quite interesting, though I don't understand most of the medical terminology." Moses had been holding a page with facility coordinates and sample transfer protocols. Dad had been reading a vulnerability assessment memo with precise nursing home identifications and addresses marked sensitive, restricted access in red letters at the top. "These are sensitive documents," I'd said quietly. "You've just committed a federal offense." Mom had laughed. "Oh, Esther, don't be so dramatic. It's just your work papers. We're your family." "These documents," I continued, pulling out my phone, "are restricted public health intelligence. They contain unredacted facility locations, vulnerable population identifications, and sample transfer information. Unauthorized access is a federal crime. Unauthorized disclosure could result in outbreak amplification and people dying." "Esther, relax," Dad had said, waving dismissively. "We're not going to tell anyone. We were just curious about what you actually do all day. These codes and numbers don't mean anything to us anyway." My phone had an emergency alert function, a security feature for exactly this kind of scenario. Unauthorized access to sensitive biological intelligence by uncleared individuals in an unsecured location. I'd pressed it while they were talking. "You need to put those documents down immediately," I'd said. "Do not read another word. Do not touch them. Put them on the table and step away." "You're being ridiculous about your boring government job," Mom had said with exasperation. "Nothing important here. Just health statistics." Dad had continued scanning the page in his hands, squinting at facility codes. "Are these hospitals? Were you tracking something at hospitals?" Moses had his phone out, apparently photographing one of the pages with facility coordinates and case identifications. "This is actually pretty fascinating, Esther. Real epidemiology work. Why didn't you ever tell us you worked on outbreak investigations? I could have connected you with some contacts in public health PR and crisis management." "Because it's sensitive," I'd said. "Moses, delete that photo right now." "It's just for my reference," he protested. "I'm not going to post it anywhere. I just think it's cool." I'd press the security alert button on my phone. The emergency response would be immediate, probably 4 to 6 minutes given our proximity to federal health facilities and CDC offices in the Atlanta area. "Everyone needs to sit down," I'd said. "Put down all documents. Put your hands where I can see them." Mom had actually laughed. "Officer Esther Marie Nolan, you're being absolutely ridiculous. We're your parents. Unauthorized persons have access-sensitive biological intelligence containing data on an active outbreak investigation," I'd said, now speaking partially for the recording that had activated when I pressed the alert button. 3 individuals present. Location 4821, Maple Ridge Court, Sandy Springs, Georgia. Materials compromised. Full intelligence packet reference number Delta Kappa 7392. Facility coordinates exposed. Sample transfer protocols exposed. Vulnerable population identifications exposed. Photos have been taken by unauthorized person on personal device. Requesting immediate containment response team. What are you doing? Moses had asked, starting to look nervous. My job, I'd replied, which you've just massively complicated. That's when we'd heard the vehicles outside. Multiple vehicles arriving fast. Dad had gone to the window. Esther, there are black SUVs and a white van in our driveway. At least 5 vehicles. People in protective gear are getting out. Some have biosecurity markings. You called the police on your own family? Mom's voice had risen in pitch. I activated mandatory biosecurity protocols for compromised sensitive materials. What happens next isn't my choice. It's federal health security law. The front door had burst open. They'd breached it with authorization rather than knock. 8 agents in biosecurity gear had swept into the living room, some armed, all in protective equipment. Federal health security. Everyone remain where you are. Do not move. Do not touch any materials. Mom had gasped. Dad had frozen, still holding papers. Moses had dropped his phone and raised his hands. Down on the ground. Hands behind your heads. Now. They'd all complied, lying face down on the carpet as agents secured the room. One agent in full protective gear had moved to me. Dr. Nolan? I nodded. Another team had swept through the house in protective gear, checking for additional persons and potential document dispersal. A third agent had begun photographing the scene methodically. The spread documents on the coffee table, the phones, the briefcase, my suitcase, everything. A fourth agent began setting up a mobile evidence processing station. Esther, what is happening? Mom had sobbed from the floor. Why are you doing this to us? We're your family. I'm not doing anything, Mom. These agents are only following mandatory containment response protocols. The lead agent had checked the documents on the table, his expression darkening behind his face shield. These are current outbreak investigation materials. Active case tracking. Unredacted facility vulnerabilities. Yes, sir. I was conducting remote epidemiological analysis. Materials should have been secured in locked briefcase inside locked suitcase inside locked room. That was done. But unauthorized access occurred when my mother used a spare key to enter my secured room and remove documents from my secured briefcase without my knowledge or permission. Your mother? The agent had looked at the 3 people on the floor with new understanding. Family members? Yes, sir. They've been briefed repeatedly over the years about not touching my work materials. I verbally reminded them multiple times this weekend that my work was sensitive and not to be accessed. Did they know the materials were sensitive? The documents are clearly marked sensitive, restricted access on every page in red letters. They were informed these were sensitive work materials. They chose to access them anyway. My brother photographed at least one page containing facility coordinates and vulnerable population identifications. Moses had started crying. I didn't know it was this serious. Esther, please, tell them it was just a misunderstanding. I thought it was interesting. I didn't mean any harm. Another agent had emerged from upstairs with my laptop case. Secure device appears undisturbed. Biometric lock engaged. No unauthorized access attempts detected. Running full diagnostic now. Thank God, I'd muttered. The lead agent had pulled me aside while his team continued processing what was now officially a biosecurity incident scene. Walk me through exactly what happened, Dr. Nolan. I'd given him the timeline. Working Saturday morning on urgent outbreak analysis. Securing laptop. Securing printed materials in locked briefcase. Leaving for errands. Returning to find family had accessed my room and removed documents. Finding them reading, discussing, and photographing sensitive biological intelligence. They're going to be arrested. The agent had said it as fact, not question. You understand this will destroy your family relationships. I understand. But those documents contain intelligence that could be used to target vulnerable populations, compromise ongoing investigations, panic communities, and amplify an outbreak that's already on the edge of containment. My family doesn't get a pass on that because we share DNA. He nodded grimly. You did the right thing. But I'm sorry anyway. This is never easy. They'd taken Mom, Dad, and Moses into custody. Flex cuffs, rights read, the full procedure. Mom had been hysterical, begging me to tell them it was a mistake. Dad had looked at me with betrayal and confusion in his eyes. Moses had kept saying, I'm sorry. I didn't know it mattered this much. But they had known. I'd told them 100 times not to touch my work materials. They just never believed those materials actually mattered enough to warrant real consequences. My sister Ruth had arrived 2 hours later. She'd been contacted as next of kin. She'd found me sitting in what was now a documented federal biosecurity incident scene, with containment teams still processing evidence and conducting environmental sweeps. What the hell happened? Ruth had demanded. Mom called me crying from federal detention. She said you had them arrested over paperwork. She accessed sensitive biological intelligence documents, I'd said wearily. So did Dad and Moses. I followed mandatory biosecurity protocols. The rest was inevitable. Over health reports? Esther, these are our parents, not terrorists. Ruth had stared at me. You've lost your mind. You're going to let our mother go to prison over your job. It's not my choice, Ruth. They committed federal offenses. The moment they accessed those documents, the outcome was determined. I reported it as required by law. Everything after that is out of my hands. You could have not reported it. Could have just taken the papers back and said nothing. Then I would have committed a felony. Failure to report a biosecurity breach. I would have lost my clearance, my career, and probably faced criminal charges myself. And if that intelligence had been further compromised, shared, or posted, it could have resulted in targeted facility sabotage, vulnerable population targeting, and outbreak amplification that would kill people. Is that what you wanted me to do? She looked at me like I was a stranger. I wanted you to protect your family. I am protecting my family, I'd said quietly. And about 330 million other people who live in this country. Your family isn't more important than public health security. No one's family is. Ruth had left without another word. The investigation had taken 4 weeks. Mom, Dad, and Moses were released on bond, but faced serious federal charges under public health security statutes. Unauthorized access to sensitive biological intelligence, unauthorized disclosure, and in Moses's case, unauthorized reproduction and potential distribution of materials that could facilitate outbreak amplification or targeted facility compromise. Their attorney, a former federal prosecutor who specialized in national security cases and understood exactly how serious this was, had negotiated plea agreements. Mom and Dad pleaded guilty to misdemeanor unauthorized access with 2 years probation, $75,000 fines each, and mandatory biosecurity training. Moses, because he'd photographed documents containing facility coordinates and vulnerable population data, faced felony charges. He pleaded guilty to 1 count of unauthorized reproduction of sensitive biological intelligence in exchange for 20 months in federal prison, followed by 3 years supervised release and permanent prohibition from working with any federal health data or contracts. My family was destroyed due to no fault of mine. The legal fees alone would bankrupt my parents' retirement plans. Moses's crisis management agency collapsed when investors learned about his federal conviction. Ruth refused to speak to me. Extended family took sides, almost all of them against me. I was disinvited from family gatherings, removed from family group chats, blocked on social media by cousins and aunts and uncles. I was treated like I'd committed some unforgivable betrayal. And maybe I had from their perspective. But from my perspective, they'd committed an unforgivable betrayal first. They'd been told repeatedly not to touch my work materials. They'd been warned that my work was sensitive and serious. They'd chosen to disregard all of that because they didn't believe what I did actually mattered. They'd been catastrophically wrong. 6 weeks after the incident, I sat in Director Matthews' office for a security review. "Your family situation has been thoroughly investigated," she said, reviewing the thick file. "We've concluded you followed all proper protocols with precision. In fact, your response to the breach was exemplary. You activated containment procedures within minutes of discovery. Your immediate reporting prevented potential cascade compromise. Thank you, ma'am. However, your home environment has been permanently flagged as high risk. Future assignments requiring sensitive materials will be conducted in secure facilities only. No exceptions. No remote work on classified or sensitive biological intelligence." I understand completely. She'd closed the file and looked at me directly. "How are you holding up, Dr. Nolan?" "Honestly, ma'am, not great. But I'd make the same choices again, without hesitation."
Good.
Because that's the only acceptable answer. Public health security cannot be compromised for personal relationships. The moment you put family loyalty above biosecurity protocols, you become a liability to everyone. "Yes, ma'am." They'll probably never understand. Most people can't conceptualize what we actually do because we work in the invisible space between outbreak and catastrophe. We prevent disasters that never happen. There are no headlines for the outbreaks we contain before they explode. No credit for the lives we save by stopping amplification. Your family will probably always see you as the person who destroyed their lives over nothing. I know. Can you live with that? I'd thought about it. Really thought about it. Yes, I'd finally said. As long as I know the truth. And I know that intelligence packet contained information that could have been used to target 3 facilities with vulnerable elderly populations, compromise for ongoing covert sample transfers, and potentially cause outbreak amplification that would have killed hundreds of people. My family's comfort isn't worth that price. Nobody's comfort is. Director Matthew had smiled slightly, though it didn't reach her eyes. "You're going to go far in this agency, Esther. Unfortunately, you're also going to be very lonely." She'd been right on both counts. 8 months after the incident, I was promoted to lead response analyst with a 28% pay increase and expanded operational authority. I was working on high-level outbreak assessments, briefing senior officials at CDC and HHS, coordinating with international health partners. My career had never been stronger. My personal life was destroyed. Mom sent a letter from her court-mandated biosecurity training program. It was full of hurt and confusion, asking why I'd done this to them, saying she'd only wanted to understand my work, that she was my mother, and deserved to know what her daughter did all day.
She still didn't get it.
She still thought this was about me being secretive rather than about protecting public health. Dad wouldn't communicate at all. Complete silence. Ruth sent one email. "I hope your job was worth it. You've lost your family forever." Moses wrote, from federal prison. Unlike the others, his letter showed some actual understanding. "Esther, I'm not going to say I forgive you, because I'm still angry. My life is completely ruined. My marriage is over. My company is gone. My reputation is destroyed. But I get it now. They made us sit through extensive training about biological intelligence and why it matters. I understand what could have happened if I'd posted that photo in the family chat like I was about to do. I understand people could have died. I understand facilities could have been targeted. I'm still angry that you didn't make me understand better. Didn't warn me more forcefully. But I also know I should have listened when you told me not to touch your materials. I just never thought it was actually important. I thought you were being dramatic about a boring health department job. I'm sorry. It was the closest thing to an apology I'd received." I wrote back carefully. All prison correspondence was monitored, so I kept it general. I told him I was sorry too, that I wished things had gone differently, that I hoped he'd rebuild his life when he got out. I didn't tell him that I'd do it all again if I had to, but I would. The outbreak investigation I'd been analyzing, the Delta Kappa respiratory cluster, was successfully contained through rapid intervention. Because my immediate containment protocols had triggered emergency facility security upgrades, vulnerable population relocations, and covert disruption of hostile actors who were attempting to exploit the vulnerability data, the outbreak never exploded beyond the initial three-state cluster. Based on my epidemiological models, if the outbreak had amplified through targeted facility compromise, we would have seen 400 to 600 preventable deaths within 6 weeks, overwhelmed hospital systems in 7 states, and potential international spread. Instead, 47 people died. Still tragic, but 87% mortality reduction from the projected unconstrained scenario. My family would never know that. The operation was classified. The success would never make headlines. But I knew, and that knowledge had to be enough. 14 months after the incident, I attended Moses's release from federal prison. Ruth was there, still not speaking to me. Mom and Dad came, but sat on the opposite side of the waiting area. Moses looked worn down.
Prison had been hard on him.
But he hugged me when we met outside. At that moment, Ruth had walked up to me. "Do you ever regret it?" she'd asked. "Every day," I'd admitted. "But I'd still make the same choice." "Then you're not the sister I grew up with." "No," I'd agreed. "I'm not. I'm someone who takes her oath seriously. You save lives as an engineer by ensuring structural safety. You understand professional responsibility. Not like this. Not turning on your own family." I did what I had to do, Ruth. She'd driven away without responding. 2 years after the incident, I received the Public Health Service Distinguished Service Medal in a private ceremony. Director Matthew had shaken my hand. "Your work on the Delta Kappa containment operation and subsequent outbreak response initiatives has been extraordinary," she'd said. "You've demonstrated exactly the kind of integrity this agency needs. The kind of integrity that public health security requires." My family still didn't speak to me. They probably never would. But somewhere out there, hundreds of people were alive because I'd helped contain an outbreak they'd never know about. Because I'd protected intelligence that prevented facility targeting and outbreak amplification. Because I'd chosen duty over family when it mattered most. And I'd do it all again.